Alrighty, so this presentation is going to be on hepatic encephalopathy. So hepatic encephalopathy is a condition that occurs because the liver cannot remove toxins from the bloodstream, and as a result, a loss of brain function does occur. Hepatic encephalopathy typically occurs when there is a condition that reduces the liver function, or in which the blood circulation cannot enter the liver, such as cirrhosis. So with this disorder, there is a liver condition present as well. So this is kind of a secondary um, disorder. So some things that can trigger that hepatic encephalopathy with the liver condition include dehydration, excess protein in the body, bleeding from the intestines, and as well as surgery and certain medications. So some general symptoms that can occur include a disrupted sleep pattern, drowsiness, some personality or mood changes, abnormal movements of the hands and arms, and sluggish movements. In addition to those general symptoms, there are cognition and communication symptoms or impairments that occur with hepatic encephalopathy, and these include changes in thinking, some forgetfulness or mild confusion, some of that mental fogginess as well, and then also poor concentration, judgment, as well as slurring of speech. So the neuropathology of hepatic encephalopathy. So what happens is that waste that the liver can't get rid of or can't remove, it travels up to the brain. And what happens there is it enters that blood-brain barrier. Once it enters the blood-brain barrier, it's going to be absorbed by astrocytes. And think back to the day when we talked about astrocytes and glial cells. An astrocyte is a glial cell, and the importance of glial cells is that they help maintain that homeostasis within the body. It helps form myelin, which we know is really important for memory, and really those executive functions, which of course, as we just talked about, are symptoms of hepatic encephalopathy. And then glial cells also provide protection for the neurons in the central nervous system and peripheral nervous system. So once the brain absorbs the waste, once the astrocytes absorb that waste, what's going to happen is it's going to decrease that energy supply to the brain cells, which we know then will decrease that function. Alrighty, so what can we do? The key to this disorder is that we treat it early and we identify it early. This hepatic encephalopathy can progress all the way to having those mild confusion, mild symptoms that we talked about, all the way to being in a coma. So early identification is extremely important to ensure that patients don't get to that late stage. There are two kinds of medications that can treat hepatic encephalopathy. And these two medications are specific, they have two specific functions. Of course, we'll leave that up to the doctors for what they're put on. But really the key is really to be able to remove that waste from the bloodstream. That's really how this can be helped, because it actually is a reversible disorder. So that's great. Treatment can reverse all of the symptoms. So as an SLP, what can we do? Of course, we can't prescribe medication, but we can really be a support for the families as well as the individual. So really providing that counseling and education. This is, of course, a secondary effect from the liver condition, which of course the family and individual are already dealing with, and I'm sure that's stressful for them already. And then to add another thing on top of that. So being that support, providing that education so that they know what to expect, know it is reversible, know what they can be doing to help. That's really going to be important to help them through this diagnosis. So As I said as well, we SLPs will become involved if a patient will become intubated. Some patients also do need to receive nutrients from a feeding tube at this point. Again, so of course we would be involved with that. And then the main overarching treatment that we wouldn't necessarily be involved with would be treating that underlying condition of the liver condition. Whatever it may be, that's really what's going to completely solve this problem, but the medication will definitely help if that liver function, needs to be delayed, or yeah, if they can't treat the liver function right away, the medication can help at least eliminate that waste, so it doesn't continue to travel up to the brain. And that is it on hepatic encephalopathy. Oh, I got it all the way through to the end. Thanks for listening. Bye.